Hi, everybody. This is Dr. Michael Hirsch, the Medical Director for the Division of Public Health in the City of Worcester, and another edition of Stay Connected with the Worcester Senior Center. One of my favorite things that I get to do is to reach out to all the seniors that follow this show and some others that aren't seniors that follow this show. I bump into a lot of people that say that they've seen me on this show, and this is a platform for me to give you some useful information, some useless information, but mostly I try to kind of get you up to date on where we are with public health in the city of Worcester. And you notice I'm wearing my smiley face hat today. That's because I'm super optimistic now. Here we are in the month of March, and you know the old expression, March comes in like a lion and goes out like a lamb. We haven't really had that severe a winter, thank goodness. I mean, there were a couple of really bad polar vortexes and crazy need for heating stations in February. I know some of you were affected with some power outages, and I'm really sorry for that. Our climate is changing, and we haven't quite figured out what to do about that. That is one of the items that's going to be in the community health improvement plan, because we're trying to figure out what the individual, what the city can do to positively affect the effects of climate change. For example, we know that with the mild winter that we've had, relatively mild, that the ticks and mosquitoes this summer are going to be bad. So we're going to be spending a lot of time in probably May and June warning people about the protection against those kind of arboviruses, that's what those are called, that are mosquito-borne illnesses. And that's something long-term that we may have to really become much more aware of, that these 5 protections that we always talk about, wearing long clothes and the 5 Ds, dress properly, avoid dusk and dawn, drain any standing water, and use insect repellent containing DEET. That may become like a new mantra for anybody that goes out with short sleeves, short pants, out to the beach. But I don't want to be negative today. That's why I wore the smiley face hat, because we're in a pretty good place right now. The pandemic really seems to have receded, and now we're going into a different phase of our COVID coexistence. The COVID virus is going to be with us like the flu is, and like other common cold kind of SARS viruses are. The difference is that in our consciousness now, when we get a cold, it's probably worth getting a test done to see if that cold is caused by COVID, and not just write it off to, oh, it's the flu, or oh, it's the routine common cold. Because we still have to worry about our vulnerable populations. The CDC just released some information that shows that in the first 2.5 years of the pandemic, the risk factors we've been talking about, being over 65, having problems with diabetes, obesity, cancer, your immune system, and also being in the BIPOC community, the Black, Indigenous, and people of color community, were risk factors for getting more sick with COVID. But in the last 8 months, it has flipped so that it's the Caucasian population, and particularly the Caucasian elderly population, that are the ones that seemingly continue to get sick enough to go into the hospital, and unfortunately, that's where most of the deaths are coming from, elderly white people. Still in a lot of these scenarios like nursing homes and skilled nursing facility, but the numbers are really way, way down. And we're averaging about 15 to 20 cases a day here in Worcester in the city, and that's very, very much lower. So this year's winter, maybe because it was so mild, kept the BA5 variant and the BB1 variant from really causing the kind of surge that we saw with the Omicron variant in the winter of 21-22. And nobody's really quite sure what is that about, whether it is climate related, whether it is that around the community there's many, many people now that have some immunity that's hanging around, either from having had COVID or from all the vaccinations that they've gotten. We might have that herd immunity thing going on. That's not to say that we're not at risk for new variants to come down the pike, but the FDA is hopeful that it will be in a cyclical way like the flu, so that we can get you your booster every year. Like you were supposed to take your flu shot every year, you'll get your booster for COVID, and it may actually be able to be combined into one vaccination, which would be great. So there's a lot of positivity in the virology world right now about COVID, and that maybe we have finally tamed the tiger. I'm cautiously optimistic. That's one of the reasons I wore this smiley hat. The other thing is that in general, people that are born in March, people that have an affinity for March, are optimistic people. My dad was born in March, and he was the consummate optimist, a consummate glass half full person. He had a positive outlook on everything. And people conjecture that's because, the month starts out kind of dreary, wintry, and then suddenly you start to see some blooming flowers, and, crocuses start coming out, and it's warmer, and maybe that's behind the optimism. But whatever it is, March people are supposed to be optimistic people. So I'm not a March person, I'm a May person. That being said, I still want to look at this from a point of optimism. We have a lot of health challenges still on the way. We uncovered in the pandemic many, many disparities that we're working very hard to eradicate. We're going through right now at the Department of Public Health a deep dive into all of the medical obstacles for our community. It's called the Community Health Assessment, the CHA. And from that, we will craft a new Community Health Improvement Plan, which is called the CHIP. And the CHIP will give us a roadmap, maybe 5 to 10 priorities that we're going to tackle in the hope that that will make a big dent into some of these disparities that we saw and some of the ongoing problems with health, either access to health or some of the actual screening for preventable diseases, or at least recognizing the diseases early enough that we can intervene before they become deadly diseases. So it's a very optimistic time to see this kind of work done, and it's being done in the Department of Public Health, but with a lot of partnering with the UMass Population and Quantitative Health Science Department, with the various institutions of higher learning in the area, like WPI and Clark and Holy Cross, for example. We're using their interns in many areas to help us collate the data, grab the data that goes into the community health assessment, and then we will crunch out what we think should be the right thing for the community health improvement plan. Now, some of you may remember in 2016, so it's a while ago now, right? 7 years. In March, we were the first accredited public health institution in the Commonwealth of Massachusetts. We were the first multi-municipality accredited public health institution also, because we had our consortium of 6 towns that we were also providing public health for. Now we're down to 3 towns because the other towns that dropped off felt that they were in need of more, personalized care. We felt we were doing a good enough job to provide them with that, but the pandemic put a lot of strain on people, and it was hard to get people, to get right on the spot in some of the towns when we were experiencing so many problems here in Worcester. But I think we're going to be a good consortium of 4 towns. It's going to be Grafton and West Boylston and Shrewsbury, and we'll see how this next iteration of the CHIP takes us, because it'll affect all 4 of our municipalities. And the collaboration that's going on between the different institutions of higher learning is getting revitalized. It had been going very strong pre-pandemic, but during the pandemic, our real relationship with the institutions of higher learning was just to try to help them with outbreaks of COVID. And we worked very closely with them, and we have a great relationship with all these schools. But now we're going to be using a little bit more of a structured internship program that will help us advance the CHIP, using some of these brilliant students who need to do community service, they need to do a practicum, they need to do a capstone project, and we're convincing them to do it with us at the Department of Public Health. So a lot of credit goes to some of our staff at the WDPH, our new director, who I'm hoping I will bring to you in one of our future Stay Connected sessions. Solo Dennis is very involved with this. He established one of these academic health collaboratives for the Massachusetts Department of Public Health about 5 years ago, and that's still going strong. So he's very committed to this kind of academic partnership. So that's, I think, so far a very bright picture of improvements in our public health evaluation, and then hopefully in designing the interventions that we want to do to make us better. So I have to do a Debbie Downer segment, right, if I've finished all this optimism. So the Debbie Downer thing is that there is a lot of drum beating in the background of the virology world, the experts on these viruses, that is sending us alarms about the avian flu. Avian flu is like our human flu. It seems to spread amongst bird species, particularly hens and some form of pigeons. So why is it worrisome? There's already been outbreaks of avian flu in the mink population in Russia and in the Scandinavian area. Mink, as you know, are these little weasel-like creatures that for years and years became very popular to be used in the fur industry. We don't use it that much anymore for that, but they're out there and they can get the avian flu. So it has proven that the avian flu can jump from one species to another. So far, it has not jumped into the human population. But the concern of COVID was that it came from a bat or some kind of a smaller crazy mammal that they have in these markets in China, that like little anteaters that the Chinese people value as a delicacy. And those are not that common compared to birds. Birds, they're everywhere. Millions and millions of birds. So if there's a really violent, virulent strain of avian flu that jumps into the human population, we could be in for an issue. So you remember back in 2009, the swine flu jumped from the bird to the swine to humans. And we were very worried that that could be a lethal situation. So we had a big campaign to get people vaccinated. H1N1 was what it was called. The one that they're looking at carefully now is called H5N1. And who knows what it's going to do. You're just going to have to put up with me kind of being nervous, Nancy. I'm going to try to let you know as soon as we know more. So far, we don't see anything yet, but what we want to do is not be caught ill-prepared. So I know already that there are many virologists that are working on vaccines for H5N1, and we're also talking about how would we handle an outbreak, perhaps handle it better and better prepared than we were for COVID. So as I think I used this term for you last month, we're all doing these hot washes now. That's the fancy emergency medicine term for reviewing what worked and what didn't work in our COVID response in 2020, right? And there are some things that worked really well, and there's some things that just didn't work at all. And some of the things that we talked about in March and April of 2020 when it first started proved to be incorrect by, July. So I hope that we'll be better prepared if one of these avian flus breaks out, right? It's really amazing how much the virology community feels much better prepared and much more armed now that the technology that went into the vaccines that Moderna and Pfizer and Johnson & Johnson and Novavax came out with, because they're dealing with these mRNA particles that they're infusing into our bodies that will then teach our immune system to react to whatever virus it is. That technology is now down to an absolute science, and I think as fast as they came up with the vaccine for COVID, which was really 9 months, I think they'll be able to put out a vaccine faster to whatever else we're facing. Now, maybe that we don't face a pandemic for many years. It took 100 years almost for the 1918 flu till the COVID flu came along. And I hope that's the case. I hope we never have to deal with one again. But I also hope that we can rev up our response team much more smoothly than we did this time around. So I'm still optimistic when it comes to the avian flu, because I do think that we're smarter at our response. We know what works, we know what didn't work. And in the meantime, the vulnerable populations that we saw so badly affected by COVID, we're really trying to protect. So, Dr. Castile has established a division within the Department of Health and Human Services only dealing with the problem of homelessness, because the homeless were so much more at risk for having COVID and unfortunately for spreading COVID, because they lived in such communal situations, in tents and, under our bridges and things like that, where there was no possibility of quarantining. So we're developing safer housing for them. And I think that's going to be a tremendous offshoot of what happened during the pandemic. We also know that the people that were suffering from substance use disorder had a higher rate of COVID as well. And probably the immune system gets suppressed when you're using those kind of drugs. And we hope that we can kind of make a difference there. There's a lot of different programs that are being considered to make it less lethal to be a substance use disorder patient, and a lot more availability of the medications that can help a substance use disorder patient wean off of their heroin habit. Now, there's no special training anymore that you have to do in order to administer buprenorphine, which is, a sublingual, under the tongue drug that is like methadone, but it's a lot easier to distribute. And we used to have to go through special training and get this special variants to give the drug. Now it's easy for any primary care provider to do that. So hopefully the folks with this problem, substance use disorder, don't necessarily have to be stigmatized and go into a special clinic with lots of other substance use disorder people. They can be treated in clinics with all the other patients who have other diseases and other problems. And, addiction is another disease. It's a disease. It's not a curse, and it's not a sign of moral fiber weakness. It's a disease. So I'm optimistic about that population having improvements over the next several years. The big problem now is that a lot of the street drugs are being cut with a medication called fentanyl. I don't know if you've heard that term. Fentanyl is a short-acting cousin of morphine. It's very, very potent. And I'm not really sure what evil genius decided to add that to the bags of heroin that they give out, because it makes the heroin that much stronger and that much more addictive, and much harder to shake as far as addiction goes. But we have some champions in the city. You know Dr. Castile from the Health and Human Services, our commissioner, has a mobile van that's going around helping both the homeless and folks with substance use disorder. Dr. Kavita Babu, who is a brilliant toxicologist at UMass, has a van also that goes around at night and tries to find the homeless that are on the street, or the substance use disorder patients that are using on the street, brings them into this mobile van where they can really do a primary care visit from head to toe and plug people into treatment and follow-up that will potentially save their lives. So Worcester's not sitting still on any of these problems. We're trying to address them very directly. And if you want to talk about violence, which is always on my mind, I run a gun buyback program every year, and it's been going for 21 years now. I always have done it in honor of my fallen friend who was murdered when I was a co-resident with him at Columbia Presbyterian Hospital in New York, now 41 years ago. We have now police officers starting here in March that are going to be wearing body cams. And I think that this is going to be a tremendous improvement for us, because we'll be able to, with those cameras, review the conduct of our officers, but also I think it'll be reassuring to see that in 99% of the cases, the conduct is excellent. There are going to be some bad apples. We know that there's community members out there who have suffered at the hands of police officers that have taken their responsibility too far. But I think that overall, with our very low rates of gunshot wounds and stab wounds, we're better than any other city in New England as far as the per capita rates of those things. I think this is going to be a great addition. You also may see, because of the use of these cameras, pictures of perpetrators that when they try to get away, we can then identify them off of this film and hopefully find them and then incarcerate them if they've indeed done the crimes that we think they did. So I think this is a very courageous step that the Chief Sergeant has done and Eric Batista, our city manager, has done. I know it's in response to a lot of pressure from the community, but these are the things that we really have to face up to. You know, we're in a country that has been seeing more than one mass shooting every day this year. And we just want to be as proactive in trying to keep the lid on violence on the street down, so we make Worcester a really attractive place to move to live in, to play in, and I think it's going to work out really well. Of course, you know, when we're in March, that means we're only a month away from baseball season. That is, to me, sweet music. And having the Woo Sox in town, and also knowing that the president of the Woo Sox, Dr. Charles Steinberg, is such a public health advocate. Now, this gentleman is absolutely committed to improving the health and wellness of our youth and the whole community. He has allowed us to use his park for staging all different kind of fundraisers for various health-related causes. He's honored first responders and other health workers at the games. He does a special pause in the fourth inning of most of the games to wave to the patients that are on the wards in the pediatric ward at UMass and the Children's Medical Center there. I mean, what more could you ask for from a baseball team? And that whole Canal District is blossoming because of the popularity of the Woo Sox. They were the team that had the highest attendance per capita of any of the minor league teams last year, and that's a tribute to the public. We are thirsty for good, clean entertainment. We put our money here in Worcester on the success of the Woo Sox in bringing in the kind of people we want to have walking around town and coming to the games. By contrast, Springfield, which has a very, very bad violence problem, they put all their money into a casino. So I think that we made the right call there, and I think that the Canal District is only going to continue to blossom. I look out my window when I'm at the WDPH. The Department of Public Health is located in an old schoolhouse called the Lamartine School on 25 Meade Street. Every day the view changes because they're building garages and they're building affordable housing, and on the Canal Street there's more and more restaurants that are sprouting. We're going to have this great little, you know, almost like the feeling you get when you go to Fenway. We're going to have our own little Yawkey Way feel all around the stadium, where there's going to be as much going on outside the stadium as inside the stadium. So Worcester is still on the march, and that's why I think March is such a lucky month, and it's going to be one where I think we're going to see some great improvements over time, and you know, then we're going to get to April showers and May flowers, but March is the beginning of a really great period for us, and I think that you're going to enjoy this month. I would definitely tell you that in the period where it's still acting like a lion, be careful. Streets are slippery. There can be black ice. You can fall. We don't want you to break a hip or have any problems with you know, injuries. So, you know, be careful. And if you're driving, you have to use a lot of caution, because it's sometimes hard with you know, snowy or rainy weather to see all the pedestrians that are out there, and to recognize when cars are stopped or cars are making funky turns right in front of you, so use a little extra caution there. But those are the kind of warnings I can give you about March. Overall, I'm feeling this smiley face feel, and I hope that you all feel that too. And we will be back next month. I hope to introduce you to our new medical director, because he's has a very, very interesting background. He considers himself a Worcesterian already, but he grew up in Liberia and came here because the city had become such a welcoming home for Liberian immigrants. So he has a unique perspective. And interestingly, Mr. Dennis is his name, Solo Dennis. He started out his public health career after graduating at UMass Amherst as an intern at the Worcester Department of Public Health in 2005. And now things have come full circle, and 17 years later, he's the director of the Worcester Department of Public Health. Quite upward trajectory for him, and I think you'll find him a very, very thoughtful and empathic person. So that's kind of all I'm going to talk about today. I'm hoping that you enjoy the conversion over to springtime, and I'm hoping also that you enjoy some of the holidays that we have this month. Last year, I was privileged to be the Grand Marshal of the St. Patrick's Day Parade, along with our former city manager, Ed Augustus. It's one of the most amazing days of my life, marching down Park Avenue and seeing the thousands of people that had gathered there, and the way that the city embraced both of us as maybe having helped to get us through a really difficult time. And I'll never forget that, and that's why I love Worcester, and I'm here to stay. So thanks very much. Enjoy yourself, and we'll see you next month on another episode of Stay Connected with Dr. Mike Hirsch.